Now, it's important that you share this story with those Canadians that still live with the fanciful notion that they live in a democracy, not a dictatorship or banana republic. Our taxpayer, publicly funded agency, the Public Health Agency of Canada, PHAC, has announced a contract with a social media intelligence collection firm based in the UK to do what? Well, to obtain data on vaccine-hesitant individuals in order to, get this, be able to deliver targeted messaging, also known as propaganda, to break through their hesitancy, contract details indicate. So, that's where my tax dollars are going, huh? On a sales campaign to convince Canadians who, by personal choice, at great cost in some cases, either financially or socially, to not drink the Kool-Aid, to now go all in and take the safe and effective pharmaceutical interventions. It's not like we could spend tax dollars any more efficiently, like maybe say paying to relocate Justin Trudeau to North Korea. Just saying. In preparation for increased vaccination education, promotion, and outreach, the Public Health Agency of Canada, PHAC, is requiring the services of a consultant to analyze the vaccine-related conversations on social media, and PHAC social media initiative and campaign performance, says the tender notice description posted online on December 22nd. So, our federal government wants to pay a private company to monitor what Canadians say online about the pharmaceutical interventions and report back to Big Brother any naughty comments so they can educate those Luddites. Is that about the size of it? The notice says the contract will be awarded to the UK-based Pulsar platform if no other supplier submits a bid meeting the requirements before the closing date. The estimated value of the contract is about $339,000. Now, Pulsar describes itself as an audience intelligence company, using artificial intelligence and smart human minds to comb through conversational and behavioral data on social media. Now, in case you're wondering who these smart, intelligent minds are, I would say they're likely the same demigod experts who've done a remarkable job so far. The notice says the consultant will need to analyze Twitter and other online sites and platforms spanning 3 years of historical data. That's right, folks, 3 years worth of posts and conversations. PHAC is seeking to obtain information on individuals who are participating in and influencing online conversations about vaccination. It wants reports produced by the consultant to provide PHAC an actionable understanding of the vaccine conversation landscape online and the conversation participants, while determining a conversational baseline according to the statement of work issued. Once this data is obtained, PHAC will run a tailored messaging campaign, which it says will seek to target communities of interest such as Indigenous peoples and millennial males, states the advanced contract award notice. Divide and conquer, folks. It's worked for centuries. The study is to be rerun within a 3 to 4 month period to monitor shifts in attitude and confidence level, says the notice. Gotta assess how that sales campaign is going and see if we need to ramp it up even more, right, baby? PHAC lays out how the consultant must conduct its work, including the establishment of a keyword-based social listening tracker to capture social media conversations around vaccinations in Canada. Digital, huh? Data must also be parsed along conversation themes such as experiences with long COVID, previous vaccine side effects, engaging with mis- and disinformation, shifts in perceived risk of infection. PHAC also seeks to obtain a breakdown of reasons for vaccine hesitancy for different regions and cities to allow for more targeted messaging. Reasons? You know what, PHAC? I'll give you this one, and it's on the house. Maybe the reason folks are hesitant is they're seeing what's happening around them, and it's not comporting with what was promised. Along with identifying regions, cities, and subgroups such as First Nations communities, PHAC is also requesting segmentation of key audiences to include demographics, interests, affinities, online behaviors, and the leading topics of vaccine hesitancy conversation for each subcommunity. The statement of work provides an example of what the consultant should do once a subcommunity has been identified. It says that once the community of, let's say, Toronto University students that indicate low confidence in vaccinations, obviously an oxymoron, has been identified, then some factors should be investigated. These include their reasons for being hesitant and the topics of their conversations, the media they consume and the content they share, and the tone they use when discussing their vaccination status. Now, I've been in sales all my life, and I've learned something that's a basic rule I live by. And that's if something's good, it simply sells itself. You don't have to convince, coerce, or manipulate folks into buying it. Out of curiosity, PHAC, is this the first time you've done this? And what safeguards do you have to protect the data from these private, or should I say public individuals, Canadians, from being further exploited? And will it be passed around to other departments to do so as they see fit? Last I checked, don't we have the Office of the Privacy Commissioner, OPC? Did the office sign off on this? You know, before Big Brother started eavesdropping on Canadians. I'm thinking inquiring minds would want to know. In fact, I would encourage all of you to send that office an email inquiring about this little tidbit. Now, the folks at PHAC are not virgins. Nope, not so when it comes to violating the privacy of Canadians. In fact, they've been mixed up in a data collection related controversy in recent months. When it was revealed, it was analyzing the anonymized movement of millions of Canadians through the tracking of their cell phones, unbeknownst to those Canadians, of course. I've got it. PHAC's new motto. What they don't know won't hurt them. What do you think, PHAC? Not bad, huh? PHAC has been obtaining the data from carriers like TELUS and other cell phone tracking companies. But in December 2021, it sought a contractor to do the dirty work directly and that access that data from cell phone towers instead and conduct its analysis. The data has been used to measure the compliance of Canadians while provinces implemented COVID-19 lockdowns. When this became known, MPs started examining the issue, and the Commons Ethics Committee told the government last spring that Canadians should be allowed to opt out of the data collection program. Isn't that mighty benevolent of those MPs, allowing us mere peasants the possible opportunity of opting out? Remind me once again, you trough dwellers, who works for whom here? Who pays the bills of these pontificating blowhards anyways? To date, nothing further has been made public with respect to the investigation, either by the OPC, who indicated that they were investigating the matter, nor PHAC. Anyway, don't hold your breath, folks. Thanks for watching. I do appreciate it. If you're watching this video, currently I'm still in, YouTube jail? That's right. I will be out in a couple of days, so you're watching it on Rumble. If you haven't subscribed to my Rumble channel, please do so. Of course, post any comments, thoughts you have on this video. And if you, like I said, if you haven't subscribed, do so. Continue to watch and check out some of the other videos, and I will see you next time.